Hello, we would like to thank and welcome everyone to the University of New England Graduate Programs in Health Informatics webinar. My name is Jeff Nelson and I am an enrollment counselor for the Health Informatics programs. First off, can everyone hear my voice? Are there any technical difficulties at the moment? What you're going to want to do if there is an issue is there is a chat function right in the bottom of that screen there where you can let us know if you're having any issues. So, if there's no issues, the main focus for taking part in this webinar is to learn more about the master's and graduate certificate in health informatics, but we'll also cover the following in the allotted time frame. So we'll be going over what is health informatics, how health informatics is a growing field, healthcare job postings, how the program works, the application admissions process, course offerings, and tuition costs. Something to note, this webinar will be recorded. You are accepting the fact that you will be part of a recorded process in which to be used for future students. We'll have some time at the end of the presentation to address some of your questions. Again, please use that chat function to type in your questions during the presentation, or if you do not feel comfortable asking in this format, I encourage you to contact me personally at 855-751-4445, or you can write to us via email at informatics@une.edu. So the others that are with me tonight are Student Support Specialist Haley Kinsella, as well as our Program Manager Megan Landry. Megan, do you think you could tell the audience a little background about yourself?
Sure. My education started with a baccalaureate of nursing from Hassan University. Then I went on to get a Master's of Science in Healthcare Administration and a concentration in Health Informatics. At the time, there weren't very many programs offering master's degrees in Health Informatics, so that was the closest I could get. As far as my work experience goes, I spent roughly 12 years working as an emergency and critical care nurse. And that's really where my love of informatics started, as I could see challenges using paper and was involved in moving to an electronic system, and I really saw the transition and how it impacted patients and staff. So I really got excited about it in that role. At that point, I moved on to be a clinical analyst, and then further in my career also worked as a clinical informatics manager. I've also been involved in running academic programs in the past with the Health IT Workforce Development Program, and I've worked as an adjunct faculty teaching in topics as well. Some of my areas of interest are consumer and mobile informatics, health information exchanges, and really how we can take any technology and tie it back to improving patient safety.
All right, perfect. Thank you. Something to note here, also a little bit about UNE Online. This is something that we're extremely proud of here at UNE. We are ranked as one of the best universities in America by the U.S. News and World Report. We are an innovative and established leader in the online learning community, and this upcoming spring we are extremely pleased to be offering a Master of Science in Health Informatics as well as a graduate certificate in Health Informatics. Going over the mission statement, Megan, do you think you could go over that with them?
Sure. The mission of the Masters of Science in Health Informatics program is to prepare future leaders in health informatics to leverage technology tools to improve health and healthcare outcomes through the execution of data-driven management techniques and strategies, to adapt to rapidly changing landscapes, and to provide leadership and innovation to the health informatics profession. Moving on to the next slide, a little bit of definition around what is health informatics. This is more of a formal definition, the interdisciplinary study of the design, development, adoption, and application of IT-based innovations in healthcare services, delivery, management, and planning. And while that's kind of a long-winded version of a definition, what I really like to say is you can pretty much boil it down to the intersection of technology and healthcare is a definition that can suit any example. For those of you that aren't involved in the field currently. I thought what I could do is offer a few examples of work that's done, just so you have some sense of the type of jobs that this might be leading to. One example would be working for a vendor company, helping to put in heart monitoring systems in an intensive care unit. Oftentimes there needs to be that liaison person that works with the clinical staff and the technology staff and understands kind of both of those cultures and languages. So this role would be used there. Another one would be, I'm aware of a startup company that's developing a mobile app that helps teenagers track insulin on their phones. And so being kind of that middle person, again, being the gap person between clinical and technology situations. And then lastly, another example would be setting up telehealth services in rural areas for folks that can't get to clinics because of where they live or transportation issues. And a good example that is using this a lot is the VA clinics, so helping veterans connect to healthcare services that they wouldn't normally get to. So those are really just kind of a brief few examples of some of the types of things that people might do in the career of health informatics. The next slide really talks about why someone would want to get a degree in health informatics, and there's lots of reasons, and I think everybody has their own reasons, but here are three of kind of the biggest things that I can think of. The first one would be career advancement. Most folks that are getting a master's degree are looking to move into leadership roles. Excuse me. This would help with that. It would help folks move from the job they currently have into the field of health informatics, but also be able to take on more of a leadership style of work. Another one is typically folks enjoy a salary increase with these jobs, whether you're moving into the field of health informatics or you're moving up the ladder while you're in informatics. Most folks enjoy that salary increase as well. And lastly, many people, myself included, really just enjoy the personal satisfaction of being able to see a problem in the healthcare industry and being able to leverage a piece of technology to improve that problem and ultimately potentially improving care for patients or improving workflow for physicians and nurses, healthcare providers. So those are, again, just, there's many reasons to do it, but those are the three that came to my mind.
Great. The next slide here, why pursue a degree with UNE Online? Our programs for the master's and graduate certificates in health informatics are designed for the working professional. While our master's program can be completed in 2 years, our graduate certificate can be completed in 1 year. UNE Online runs off of an 8-week session rather than your typical 16-week semester, which allows students to work full-time and to also be able to concentrate on one course at a time. We offer 6 sessions in 1 year, which allows programs to be completed at a faster rate as well. The program is 100% online, which means no campus visits and no mandatory time that you have to be in front of the computer. Haley will be going over the structure of the program and how it's run weekly in just a few more slides. So my job responsibilities here as an enrollment counselor start by answering any questions you may have about the health informatics programs. I keep the applicant up to date with what has arrived as well as what is still missing from the application folder. One stigma that is associated with the application process is that when you apply with your online application, that all your application materials are needed to be in at the same exact time. That is actually incorrect. You do have the ability to fill out that online application, and then you'll be able to send in the materials, the rest of the materials, as soon as you have them ready, as long as it is before that application deadline. So as I will be your contact for the application process, once you're admitted into the program, Haley will be your student support specialist. Haley, do you think you could tell everyone a little bit about your role here?
Absolutely, and it's great to be here. As a student, you will have a student support specialist who's going to help you with the logistics of being a student, and I'm excited to be serving this program. So I'm going to help you from the point of orientation, course planning, sequencing, all the logistical support, official paperwork that you're going to encounter while you're an online student with UNE. I'm also going to help you navigate the 6-week sessions. As Jeff mentioned just a few minutes ago, we do have 8-week sessions, not 6. We have 6 terms a year. That way students can really accelerate through their program. And it's an asynchronous program, meaning that you can do it on your schedule. I'm also going to help you with graduation planning. You know, as we approach graduation, filling out your graduation application, and if you want to come to Maine for graduation. So in short, I'm going to help you by being your first point of contact for any concerns that you have while you're a student.
Great, thanks Haley. Going over the curriculum structure, the Master of Science in Health Informatics is a 36 credit program that has 12 courses, while the Graduate Certificate in Health Informatics is an 18 credit hour program that consists of 6 courses. Megan, do you think you could go over the curriculum structure a little bit more in detail, maybe go over the course offerings as well to give everyone a little bit better understanding?
Sure. So as you can see on the screen, this is a list of the courses that folks will be taking while they're working on their master's degree. A couple of the classes that I'm most proud of that I'd like to point out would be the 610 course, where we spend full 3 credits really looking into healthcare quality and how we can utilize technology in those fields. So that's really exciting to me. Another one that I think will be very helpful to folks is the 3 credit project management course that we'll be doing, and this will really take a very deep dive into the details of project management. Anybody that's been involved in any implementation knows that having those skills is invaluable, and having that knowledge will also help you if you are interested in taking certification exams in the future. And then lastly, I think another one of my favorite courses would be the Emerging Opportunities course, where we take another really deep dive into the future of healthcare and technology. I think that'll be a fun and exciting course where we can look at what the future holds and really, prepare people to be on the cutting edge of that technology. The next slide is a list of some of the jobs that I think people will have in the industry. You can read the list, but I think that analyst jobs is what comes up a lot, consulting jobs, and then moving on to director jobs, management jobs, chief information officer jobs.
All right, sounds good. Megan, I just had a quick question for you. What types of different backgrounds are you seeing for students interested in these programs?
We'll take a variety of backgrounds. A lot of folks will come to the program with a background in healthcare or IT, but that's not an exclusion. I think a well-rounded candidate is what we're looking for.
Okay, perfect, thanks. On the next slide here, you'll see some costs associated with the program. As you can see, our program is $650 per credit, with a $75 technology fee per semester, as well as a general service fee of $45 per semester. We do offer financial aid to those who may qualify, and we also have a great financial aid department that can go into detail with you about payment options as well. So for more information, please take a look on our website at www.une.edu/SFS/online. So the program prerequisites are pretty standard. We are looking for a bachelor's degree from a regionally accredited U.S. college or university or its equivalent. And if the applicant has earned their bachelor's internationally, we ask that you get your degree evaluated from a third party for U.S. equivalency. We also look at past college GPAs. We're primarily looking for students who have a GPA of 3.0 or higher, but if you fall below that mark, we'll look into the other materials a bit more closely, and we may, at that point, reach out to your references. Applicants must also have sufficient computer skills to be able to navigate the internet and effectively participate in the online program. Another prerequisite is that you own or have regular access to a computer and an internet connection with the necessary software. The final prereq that we are looking for, but it's not mandatory for your acceptance, is that you have taken an intro to research course and a statistics course in the past. So the next slide, for the application process, we would need the following materials submitted before the application deadline for acceptance into the program. First thing is submitting an online application and paying that $40 application fee. Second thing is you'll need to request your official bachelor's degree transcript to be sent directly to us. We cannot accept any copies of that. Next thing is you submitting a professional resume. Also a goal statement from anywhere from 500 to 1,000 words describing your experiences in the field, particularly your experience, your capacity to succeed in a distance learning format, and your professional goals. The final piece to the application is for you to give us 3 names as references. Accompanying those names should be their relation to you, best email and phone number to reach out to them as well. The reason we ask for this is that if for some reason there are questions surrounding your application materials, we can reach out to 1, 2, or all 3 of those references to help our admissions committee make that decision. So as a thank you for attending tonight, we're actually going to be waiving that normal $40 application fee if your online application is submitted by the end of day this Friday, October 23rd. We also work with rolling admissions as well, to let you know a little bit about this, which means that as soon as we after you've finished submitting your application materials, that folder is brought right over to our admissions committee, and you can find out if you were accepted in as early as 2 weeks. So we're nearing the end of the webinar, and we'll have some time for you to ask some questions. I'll start off by asking, there's one question here saying, how would you describe typical class assignments? Megan, do you think you could go over that question?
Sure. Well, they're all going to be a little different. I think there's a lot of similarities as well. And really there's 3 types of buckets of work that people will be doing every week, typically. There'll be the discussion board where there'll be real-world questions and the students will have to discuss them back and forth. We try to make that as meaningful and as lively and as exciting as possible. Another one would be a weekly, typically they're written assignments. It is a writing intensive program, so a weekly written assignment, and then some faculty also have one larger paper at the end of the term.
Okay, thank you. This next question is for you, Haley. How many hours should a student reserve for class each week?
So it is a graduate program. It's a master's program, so it is a very rigorous program, and we recommend that you reserve a minimum of 15 hours per week for your schoolwork.
Okay. Next question is probably for myself here. Can I transfer previous course credits? Yes. Upon acceptance, students may transfer up to 3 credit courses into the master's program, while we're able to accept 2 3-credit courses into our graduate certificate program. So if you have any questions on how to exactly do this, please let me know by calling or emailing me, and we can get into further discussion on how that all works. Let's see. So the next question is UNE accredited. Yes, the University of New England is regionally accredited by NEASC, which is the New England Association of Schools and Colleges. To learn a little bit more about this accreditation, please take a look at their website, which is found at www.neasc.org. Let's see, so the next question we have here, probably for you, Megan, can you go over the difference between those interested in nursing informatics compared to health informatics?
Sure. Nursing informatics differ from our program in a couple of ways. The nursing informatics programs typically have a core curriculum of nursing courses, which are the bulk of the courses, and then they would offer a handful, maybe, if that, of courses that would be informatics courses. The other thing to mention about it would be that the nursing programs are very nursing theory centric. One of the advantages we have is we can give you all of those courses in health informatics, and we can be very broad-minded about the content that's in it. The other small caveat I would mention is if you're interested in teaching to nursing students, you do need to have an MSN degree from nursing school.
Okay, great. So the next question here, how many students do you accept into the program? So there is no cap on the program, but we make sure that we do not sit more than 20 or so in each course. If there are bigger numbers than that 20, what we tend to do is just add another section so we can keep class sizes down to a minimum. So.
Okay, so the next question that's come in is, can you combine Masters of Health Informatics with Public Health? And so if the question is, can you combine the education of those two, right now I would say no. Our programs are separate, but they do logically kind of fit together, so I can understand why you're asking that. But they're two separate educational programs, 2 master's degrees and certificates right now. If you're asking about the careers, there's definitely an overlap in health informatics and public health. We work together hand in hand often, so I can see the natural progression there. Another question that's come in, can you recommend any legitimate websites to go find out more about the field? I can't think of any one website that's going to tell you all about the career. There are several association websites that would tell you about the career in different ways. So there's a website organization called HIMSS, HIMSS, and they have a very robust website with lots of links that can talk all about the field of health informatics. It's also called Health IT or HIT, so those are other terms that you would run across, and they all are, give or take, the same thing. Another couple of professional organizations would be the American Nursing Informatics Association or the American Medical Informatics Association, and they both offer a lot of information about the types of jobs that people would get and details about the field.
Okay. Another question, you mentioned prereqs on statistics in some other subject. Will you provide those, or are those to be taken elsewhere? So they are recommended, but they're not a necessity to take before starting the program. So please don't let that hinder your or take you back on filling out the application and going through the process.
So one question we have for support is, what kind of support do you offer in job placement opportunities? Well, first of all, you're going to build your network within the class. You're going to meet a lot of people in health informatics. So your professional network is going to grow immediately, just on the first day even. So that'll be one thing. While you're taking your classes, you're going to learn about local opportunities through your research and through projects. So you're going to learn more about what options you have available to you. And finally, we do have career services for our students. And the Career Services Office will help you make your resume, your cover letter, and your professional presentation geared towards the career goals that you have. So yes, we do have support for students looking for career help.
The next question is, what's a typical type of job that one would get after getting this degree? That's a great question. I would say that there isn't a typical job because the field is very, very varied. Most folks will work in healthcare organizations, again working in teams that would be somewhat of a liaison between the technology folks and the clinical folks, but there are a lot of other jobs. There's jobs working for insurance companies, there's jobs working for data analytic companies, for health information exchanges. The list is really very wide right now. For career changers, do you need to have a background in healthcare or IT to be successful in the field? The best way I can answer that question is kind of just to use my own experience as an informatics manager. So we definitely would hire people that had knowledge about health informatics, but their background kind of would move you towards certain degrees, certain jobs as well. So if you had a background in healthcare, you would kind of move into the healthcare side of health informatics jobs. But then there are a lot of very technical jobs that an IT background would be very helpful for as well. So you don't have to have either of those backgrounds, but they would just be further information for jobs.
All right, so the next question is the certificate a step towards the master's? In other words, completed during the process or a separate program of study? So the certificate can be taken first and also be applied towards the master's degree, but you can only be enrolled in one program at a time. So I think that answers that question.
Okay, the next question reads, will the course bear resemblance to the HIBA's master's program if you know it? I'm an ex-CMIO Puerto Rico Health Department. Are the courses the same as Oregon's program, Dr. Hirsch's program? Well, our program, I think all programs have a lot of differences. I am aware of the program in Oregon. I'm also aware of curriculum that they put out for the Health IT workforce program, and I think that we covered a lot of the same material, but again, every program has some differences as well. So I'm not sure if that answers the questions. I'm happy to talk to folks if they have particular questions about the curriculum and the courses that we're going to be offering. It might be a little easier to talk about that in person.
All right, next question is, if you have a master's degree, will you still need the bachelor's transcripts? So yes, we would love for you to request both your master's and bachelor's transcripts. However, it's only a necessity to request your bachelor's for the admissions process.
All right, we have a question for support. Are there any Windows or Mac only requirements for this program? No, you don't have to have one or the other. I think it's more important that you have a fairly recent computer that has the basic word processing, presentation, spreadsheet kinds of software. You also want to be sure you have a webcam and a microphone so you can communicate with other students. And that's something that we'll go over in orientation. But no, you are not restricted to one kind of computer.
Okay, another question for me. What other higher graduation courses will you take after finishing the master's course? Like a PhD? Are there postgraduate courses if somebody is interested in doing more? So I think what you're asking for is what comes after a master's degree in the field. I will say that there are a few schools offering PhDs in health informatics. They are rare. They do tend to be full-time residency style programs, but there are a few of them, and there are also a couple online programs as well. As far as postgraduate certificates, I am not as familiar with any of those. Next question. Does nature of health informatics jobs allow to work from home or work on the weekends or part-time while still holding a full-time job, let's say, a full-time nurse in a hospital? Well, there's always an exception to the rule. I would say that most of the time these type of jobs are full-time salaried positions. Most often the Monday to Friday type jobs, office style. But there's a potential that there's exceptions to that I'm just not thinking of.
Okay. How many credit hours is each class worth? Easy answer to that is those Each class is worth 3 credits, all of them in the both the master's as well as the grad certificate program. All right, next question. This Friday is awfully soon. How can someone get everything submitted by then to save the $40? So we would just need for you to submit the online application only. The rest of the materials can be submitted, and they can be submitted, just before that application deadline. Another question here is, can the master's program be completed in less than 2 years? The master's program cannot be completed in less than 2 years. Because there's 6 sessions, you'd be taking one course every session, so it would have you completed again right around 2 years.
How can you apply this education to a certain healthcare field? Examples are eye hospital setting or dental practice. Again, like I talked about in the beginning, I think anytime you see the technology and healthcare coming together, there's an area to have this role. Using the example of a dental practice, I would say most current dental practices have some type of electronic patient tracking system, and so there's always, it probably seems like these systems are capable of just kind of plug and play, but they really aren't. They require somebody to be a middleman to help kind of make them specific to the particular areas that they're in, whether it's a orthodontist, let's say, versus periodontist. So there's always some area to have that kind of liaison and middleman to work in between the roles. Next question, can you explain how this would be more advanced than the bachelor's in health informatics? I already have a bachelor's in health informatics and the course list seems identical. This is a really good question. I'm glad that you have your bachelor's degree in health informatics. There are very few of those, so that's kudos to you for being able to accomplish that. The master's degree, any master's degree is always going to take any content and it's going to tweak it to thinking big picture, thinking future, thinking about leadership and management skills. So the content will be covered, but I think it will be also from a different perspective. You will be thinking from a perspective of a chief information officer rather than somebody working on the job. So it's really kind of that next level of mentality that we try to embed into the curriculum. And another question here, and I want to thank everybody for sending these in. These have been really good questions. What's the job outlook for health informatics? The field is growing exponentially. It really would be a easy search online to be able to see article after article about the percentage of jobs that are growing online. I think you'll see that the future is very wide open and only growing. Every time I think I know of all the jobs that are out there, I look again and there's new titles, new job descriptions, the creation of new technology, so therefore the creation of new jobs. So I see the field and the research would support me that it's very much growing.
All right, a question for support. Will it say that I earned my degree online? No, your degree will not say online. It will say the University of New England. And one quick note about that, the University of New England has a long history of respected health programs, as we have a medical school, a pharmacy school, and a school of dental medicine. So long prestigious history with that degree that would say University of New England.
Great. Next question is, what if your college or university does not appear on the drop-down list for the application? So if your college or university doesn't appear as an option, what you're going to want to choose is school not listed. And then you can, when you talk to me, you can kind of go into detail of, what your past education looks like.
Okay, another question for me. Upon graduation, do we have a seat for state board exam? I don't think I have enough information to answer that for you. So it would probably be better if you reached out to us and we could have a conversation about exactly what type of board exam you're referring to, because I don't want to misspeak. So just reach out and we can answer that question for you. The next question is, do we have to be licensed to work as a healthcare informaticist? The answer is no. There is no licensing for this type of job or career. There are certainly subcategories like nurses and physicians that have licenses, but as a general statement, you definitely do not need to be licensed. Another question that came in, is this degree applicable to the pharmaceutical industry? Again, I would go back to the fact that pharmaceuticals companies, they constantly are having that interaction with consumers and patients and healthcare providers, and technology is in the middle of all of that at this point. So I would say yes, definitely applicable. And lastly, I think, if there aren't any more questions, what is the salary outlook for graduation? This is a good question and something that folks ask a fair amount. It's a little bit hard to answer for this reason. Every geographical area is different. So I hesitate to answer because I know that the markets are very different depending on where you live. That being said, I certainly know examples of folks that enjoyed substantial increases going from, just as an example, from an RN to somebody working as a nurse in an informatics department. I hesitate to put numbers on it because of the differences in salaries across the country. So.
Okay, so that actually wraps up the Q&A session for our presentation tonight. Just as a heads up, we're currently accepting applications for our next start, which is our spring session, which begins in early January. The application deadline for that session is December 14th. Again, please take 5 minutes of your time, fill out our online application to save yourself $40. This opportunity will only last until this Friday, October 23rd, end of day. The online application is the only piece you will need to submit by Friday. The rest of the application materials you'll have until December 14th. So we'd like to thank you for participating tonight, and for more information, please reach out to myself with any questions you have regarding the Master of Science in Health Informatics or the Grad Certificate Program. Again, you can reach me at 855-751-4445, or you can email me at informatics@une.edu. Thanks.